bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
I'm Mark Curtis, and welcome to Comcast Newsmakers. We have a fascinating medical issue to talk about today. I think most of us have heard about postpartum depression in moms who have just had a baby, but believe it or not, the same condition can affect men. And here to talk about male postnatal or postpartum depression is Dr. Will Courtenay, a psychotherapist who's based in Berkeley. Good to have you here.
Well, thank you, Mark. It's a pleasure to be with you.
I am very surprised to hear that this exists in men. Tell us about it.
Well, the clinical term is paternal postnatal depression. And what that means is that a dad is depressed sometime within the first month through the first year or so after his child is born. Now that's different from the daddy blues, which many dads can experience. With depression, the symptoms are more severe and they last longer. So if a man has the daddy blues for more than 2 or 3 weeks, he should talk to a mental health professional who specializes in working with men.
Okay, let's talk more about this, because we think of having a child as being the happiest days of our lives, and so I didn't know that this even exists. I know it exists in women, and sometimes it's a hormonal or sometimes it's just post-pregnancy, but this is men. Mm-hmm. What are the causes of it?
Mm-hmm. Well, so we're just beginning to learn what some of the causes are, but they're also very important to think about because they're also the keys to prevention. It's likely that sleep deprivation plays a major role. We know that when normal, healthy adults go without sleep for 1 month, they begin to show clinical signs of depression. So lack of sleep probably plays a role. Hormonal changes may also play a part. We think of hormonal changes in women and childbirth. We think of pregnant women and nursing moms, but dads also experience hormonal changes before and after their child is born. And it's a double whammy. Not only do our testosterone levels go down, but our estrogen levels go up. And this can really wreak havoc on a man's functioning and set the stage for postpartum depression. There's also some evidence linking low testosterone and depression in men. Changing social norms about what men are supposed to do and fathers are supposed to do can also contribute. Dads are expected to be much more involved in parenting than ever before. And most dads I talk to say, sure, I want to be involved, but then it's like, well, what does that really mean? What does that look like? Most of us had dads who had a completely hands-off approach to parenting. So that can leave dads really uncertain about what they're supposed to do. And that uncertainty can very quickly lead to anxiety, and anxiety often leads to depression postpartum.
Is it part of it too, perhaps, one of the causes being a reflection of our own self-esteem? All of a sudden we look at the responsibility of being a dad and we go, boy, am I good enough? Can I step up to this?
Mm-hmm. Absolutely. And a lot of dads actually experience that. We don't know that because new dads rarely talk with one another. But that certainly plays a part, again, because we don't have any training about how to be dads. And men in general like to feel in control, like to feel like we know what we're doing. And when we are put into a game like that, it's like being thrown into a game without the rules. Mm-hmm. And it's very hard for a lot of men.
I'm going to pick up on something you said. Dads rarely talk to other dads about these things. There is a stigma about mental illness, still is in this country, and it may be more true for men. I mean, how much is that part of the problem in terms of seeking treatment, that a guy would close up and not talk to anybody, let alone a doctor about it?
Well, unfortunately, that is the case. Women are more likely than men to seek treatment. And there is a stigma for men that they're just supposed to buck it up, be a man, and kind of power through. Unfortunately, that doesn't help men in any way, really, especially men with depression, which is a very treatable condition. And fortunately, on the other side, more and more men are coming forward and getting the help that they need, and that's becoming more common.
And I want to mention your website, because there's good information there, and there's nothing wrong with seeking help or calling a psychotherapist like you to get help if you're a dad in trouble. It is www.saddaddy.com.
Yes.
Dr. Will Courtenay, thanks for being with us today.
Well, thank you. It's been a pleasure.
Thank you for joining us on Comcast Newsmakers. I'm Mark Curtis. We'll see you back here next time.